There we go.
Hello, good afternoon, everyone. Welcome to our second scheduled, but our first local management board FY26 community partnership agreement planning, community feedback meeting, listening session, I think is what it's called. I always mess that up. So welcome to today's meeting. What's happened is we've developed a condensed PowerPoint presentation just to give everybody an overview of how things have changed for fiscal year 26 in the community partnership agreement. Just to let people know about the acronyms on the front screen, it's local management board is LMB, NOFA is notice of funding availability, and in parentheses, it's CCIF, which means Children's Cabinet Interagency Fund, which is where the LMBs get their money from, and that goes to the Governor's Office for Children, who then allocates the funds to our local offices. So if there are any issues with our voices not being able to be well, just let us know. We will speak louder or adjust things. Also, the cameras, you may know, has changed a little bit. The one that kind of follows people around when they talk is not working, so we have to use the overhead only camera for today's planning meeting. So you'll be seeing probably myself, Henrietta Lees, who's one of our local management board members. And then we have the staff. I don't know if you can see everybody that are from our office. Sadie Liller is attending from her office. I think she might also be involved in another meeting right now. So thanks, Sadie, for being able to attend this meeting as well. But we have Jillian Shreve, Katie Shadle, and Lindsay Broadwater. And I didn't mess their names up, get them exchanged. Didn't call anyone Brianna today like I usually do. No. So that's cool. Yeah. So welcome to those attending virtually. It's great to have you. So we're going to go down through this, the PowerPoint. If you have any questions, you don't have to raise your hands. Just unmute yourself and say, hey, shut up, Fred. I have a question or I have something to say. No, I don't care if you tell me to shut up. It's fine. All right. So here's, we had our initial meeting yesterday. Henrietta was the only person that showed up. We did talk a little bit about, Henrietta had some great questions that she might let us know about today again with the notes that you took, because you want everyone else to hear the stuff. Maybe. No, we will. We'll prompt you to say, come on, help us. Yeah, so today is, Friday, March 14th. This is our planning data meeting number 2. We have an LMB meeting scheduled for March 20th, where we'll provide the LMB with an overview of what's happened with really the only one meeting that we're having that's being recorded, and getting some actual real person feedback, except for the one we had yesterday with Henrietta in attendance. And then we have another meeting in April 17th, as you can all see on the screen. And we'll talk more formal about that in the local management board, about some of the priority areas and what the local management board would like to see how the funding is going to be directed and utilized in Garrett County. And then it's due, the NOFA Community Partnership Agreement is due on Friday, April 25th. Is there a certain time of the day that it's due on the 25th?
I don't remember off the top of my head.
Probably by close of business. But with the way Lindsay's been working, she likes to have things done at least 3 days in advance. So I might encourage people just to wait until the day it's due and then just push the email, the send button.
But not 4:59.
But not 4:59, because that becomes a problem. All right, let's go ahead and move on. All right, so here's an interesting thing. I think, Lindsay, did you send the NOFA with was it uploaded?
I don't know that I sent that to the full group.
So this is all posted on our My Garrett County page under Local Management Board, Garrett County Local Management Board. So you can see the way things have been changed is a lot of this stuff for fiscal year 26 is going to be aligned with Governor Moore's Enough initiative. There'll be more information that's mentioned here in the first bold section under LMBs can invest in one or more of the following community support initiatives aligned with the current community plan. And so there's 3 bullets under there. we did, this was designed to make it kind of more easy to read, hopefully. And then there are active links that you'll see in the PowerPoint. I think it's this one. If it's not this one, it's the one that's posted to look specifically at the data that might be referenced to help clarify what some of your questions might be or help answer the issues that you might see as kind of confusing maybe for Garrett County, or how come Garrett County really doesn't qualify for a whole lot of stuff. And a lot of that, as you probably heard, Julie might be more familiar with this because she's done some grants related to, I think you helped us with the capacity, or submitted the capacity building, or did we do that, but Julie helped?
We submitted it,
Okay.
but Julie helped us with it.
So a lot of the Enough initiative areas are focused on percentage of children living in poverty. Now, the percentage that they focused on with the Enough initiative and through Governor Moore's focus areas is at least 30%. If you have 30% of your kids under the age of 18 living in poverty, you are eligible for a lot of other funding opportunities and programming through the state of Maryland right now. I think our highest, do we have it in the PowerPoint or not? Our highest, we do. Our highest community was, I think, Grantsville, which was 27 maybe.
It might have been accident.
Oh, was it
And then
accident?
Grantsville was close.
Yeah. So the other thing to keep in mind, thanks Lindsay for specifying that. The other thing to keep in mind is under our capacity building grant, we had to focus on the top 4 areas in our county that would probably benefit from some of these issues or service strategies that would then help families become more economically secure. I think is that the official term that's used now?
They're saying economic mobility.
Economic mobility.
Yes.
So that addresses things such as education, job seeking, job placement, and then having enough money theoretically to just pay for the best basic necessities. So is there anything else on here that we have to focus on the first page? So I will mention, go ahead, Lindsay.
No, I was just going to point out that the 2 groups of bullets, the first 3 up there are things that the local management board can kind of choose one of or all 3 of those items to fund. And then the next group of bullets, the 2 that mention the fiscal mapping and the local care team, those are required to be supported by the local management board. I don't think funds necessarily are linked with either, but
So they are linked to the local care team,
oh yes,
because that's what you and I do.
yes,
And then I think just about all of our staff are somehow involved in the local care team meetings, as are the community partners, but it helps pay for a lot of our time in the local care team meetings. The other thing to keep in mind, you're noticing the first bullet that Lindsay mentioned about required to engage in at the bottom of the screen is the LMBs are going to oversee the maintenance and enhancement of county level fiscal mapping efforts. And Lindsay did a great job about putting in parentheses, more information will be found on page 12 of the NOFA. And I do believe the NOFA was uploaded to the My Garrett County page under LMB. So if you want to look at that, that's great. Fiscal mapping, really what it means is they're looking for us to work with our community partners, organizations, to find out where everybody is getting their money from and how that money is being used. And so the Governor's Office for Children, at the request of the Children's Cabinet Interagency Fund, has been asked to have the local management boards kind of oversee this initiative and work with a vendor that the Governor's Office has contracted with to obtain this county level fiscal mapping data. And it's not to take money away from the counties, but it's just to give the state a better idea and the county itself a better idea of how much money is coming in to the county from outside entities. And it could include the state or federal government as well, or private grants. And how is that money being directed to meet the needs of the communities? All right, let's go ahead and go to the next one. And please remember, if there's any questions, please just say unmute and start talking. All right, and so here are the Enough initiatives, excuse me, that our community partnership agreement, it can be one or all 4 of these. And as you can see, they've changed. There used to be 8 result areas that the Governor's Office for Children established to have community partnership agreements and the LMBs addressed through programs, strategies, initiatives in the communities. So here's how they've changed, you can see. It's cradle to career education. I won't read through all of those because it becomes a little challenging. Did you all hear a big buzz sound?
We don't know what that was.
Henrietta has her phone turned on.
No, she does not.
She just lost
Quit
its solitaire.
picking on me.
Can you all hear us? Can someone let us know?
Oh my gosh.
We can hear you.
Did you hear that buzz sound?
I didn't hear it, but I can hear you guys fine.
Yeah, so if you see us jump, that's because there's like this static sound going around. So cradle to career education is one of the 4 enough result areas. The next one is healthy families. That's not the program Healthy Families. That's a little misleading when you read that. So I will read what Healthy Families means. It's ensuring community member and family access to high quality, comprehensive health care with goals of decreasing infant mortality, increasing life expectancy, and improving behavioral health, which includes mental health. So that's a very broad description of what Healthy Families are all about under the Enough initiative. And it's interesting, as you can see, that they're addressing really a sense like across the lifespan. So if you're going to increase life expectancy, that doesn't mean you're going to stop at 18 or 24, where a lot of programs stop with up to the transition age youth. You're going in from probably conception until you're no longer alive. See, Henrietta just said the grave. So she'll be our problem child today in the meeting. The what?
Cradle to the grave.
Cradle to the grave, yeah. See, instead of cradle to career education, we should change this to cradle to grave.
Telling you, yeah, it should say.
All right, and so the next one is economically secure families. That's what I misnamed earlier. So that's where we talk about higher employment, entrepreneurship, resulting in livable and family sustaining wages and stable, thriving households where families can provide for necessities, weather hard times, and build wealth. And then the last one, safe and thriving communities, creating communities where residents feel safe and where the built environment supports their ability to thrive, including high quality, affordable housing, a thriving commercial core, and access to recreational spaces, nutritious food, and transportation. So as we went down, I know we went through those quick, but the interesting thing is there's a lot of stuff happening right now in Garrett County that other departments within our health department, other community members, some of them are with us on this call today, and community initiatives in general are really starting to expand some of these enough result areas without specifically saying, hey, these are a component of the result enough or the enough result areas. I don't know if Shelley and John had joined us or if we had when we talked about the capacity building grant. And we mentioned that Julie had helped us as well as you and John, Shelley, getting the data together to get that capacity building grant together, focus on the 4 communities in Garrett County, which will be involved in some results-based accountability training and then some more prioritized focus groups that will occur later after the initial results-based accountability sessions take place. I think it's now in April.
Yes.
Correct? Yeah. Right. So any questions about the 4 enough result areas? Okay, great. We'll keep moving then. Okay, so I mentioned when we first started, here are some of the criteria for what is meant by a high poverty community, and in order to be eligible for some of the more specific enough grant programs. So we didn't have any in Garrett County for the enough initiative specific programs to address high poverty communities. What we were available for or eligible for, and I did mention this early, was a capacity building grant. As you can see in the green font below, communities that have at least one census tract where more than 20% of children are living in poverty, not currently eligible for the Enough Grant program. We had 4 of those, I think, in Garrett County, which were Accident, Grantsville, Kitzmiller, and Bloomington. So these are going to be the prioritized communities for the results-based accountability. And so what the local management board might have to think about and what we want the community people to think about. Hopefully people who listen to this presentation later and or do the survey, I think that Lindsay uploaded, correct?
Yep.
For on the local management board site. And I think, did John help publish that?
He did,
I think.
yes.
So thanks, John, for doing that. And then we might have to consider focusing some of the strategies or the implementation initiatives in one or all 4 of those communities, opposed to Garrett County as a whole. But we'll talk and address that in our community partnership agreement and probably submit the proposal as addressing the entire county, because we want to be a population-based initiatives, not just town-specific initiatives. All right, let's move on. So here's some more breakdown of the Enough criteria. This is again through the Children's Cabinet Interagency Fund. We have to demonstrate through the local management board community partnership agreement that the services and strategies that are initiated and paid for are in alignment with this initiative. And as you can see, here are some traditional, those of us, there's 4 of us, I think, no, 5 of us now, 3 of us in the room and 2 attending virtually, who are almost or are RBA certified. So some of this language will sound, these are population outcomes. You can see in the box, the big box on the screen, where it says all residents feel welcome, valued, and have a role in the growth of their community. So what that means is you can, in essence, put all residents in Maryland will feel welcomed. And then you can put on this in the second one, all children in Maryland have access to high quality education and care while ensuring smooth transitions from birth until working in a career. All families in Maryland have access to affordable, high quality health care, including maternal, mental, and behavioral health care. All families can meet their needs, work with dignity, and build wealth for the future. All residents in Maryland or of Maryland communities feel safe and have access to high quality affordable housing. We've talked about these already. A thriving commercial core, recreational spaces, nutritious food, and transportation. And so this is a summary of the previous, 4 slides, I think. But we wanted the visual people, we wanted to make sure you could see this so you can kind of put everything together with your eyes and get them organized in that brain of yours, so you can say, okay, now I can see the connection between the pillars, the goals, what the core ingredients are to all this wonderful stuff. Okay, let's go to the next one. All right, so here's community needs assessment and asset mapping. So here's what we've included already with so far in our LMB planning. The LMB should align with the Children's Cabinet priorities and local plans. We've done that over the past several years. Local plans, what are we going to use? Well, we're going to use the Garrett County Community Health Assessment and Focus Group data. That was a instrument that was developed and completed by Shelley and John with the Office of Population Health, Innovation and Informatics at the Garrett County Health Department. Our office facilitated or helped facilitate the focus groups that took place after the surveys were completed and calculated by Shelley and John's unit. There should be a direct connection between community voice and input and allocated funding resources to be aligned or prioritized community-based services and strategies. That's been missing for the most part in local management work planning over the past several years. Typically what happens is the LMB meets. They say, well, what did we fund last year? And they say, yeah, I think we should fund it again this year. Well, that's not what can happen. Now, our office, our staff, we're not supposed to tell the LMB what to fund. However, they typically look at us and say, well, Fred, now this year will be Fred, Lindsay, Katie, Jillian, Sadie. They might even call Julie in and say, Julie, you used to be here. What did you fund when you were with the LMB? They might even call Tiffany and say, Tiffany, what did you fund when you worked in the LMB? So we've had people from about every unit in the health department that's worked in our office over the past several years. So please understand that just because a program or service was funded the past 2, 3, 4, 5, 15 years does not guarantee funding for fiscal year 26. And so the LMB, when we meet in the LMB meeting on, is that April, later
Later the 20th.
of March, and then again in April, we will make sure everyone understands that you have to think about the funding that doesn't matter who's funded now. It matters what we're going to direct our funding toward, what the LMB wants to see the funding directed toward with these enough result areas and initiatives. Henrietta asked a great question yesterday. Do you remember what you asked us? Lindsay, do you remember what, or Katie, you asked what would happen if none of these programs were funded?
Oh,
Right?
yeah.
And so the question was, well, how do you know? Because there's not good data sources for a lot of the enough result areas. So that's, and I think we had someone, was it a survey, say
Yes.
they're not pleased with the lack of relevant data. And so we thought about saying, hey, why don't you contact our population health innovation informatics unit and ask those two individuals to give you more breakdown zip code data based upon the community health assessment as it might relate to the enough result areas that have been prioritized. We didn't do that, Kelly and John. Just want to let you know that we might do that with one of the survey results. But what we'll do is we will, what will reference people when they do get us, when they ask those types of questions, we can reply to them from the survey to say, hey, you might want to check this data source out because it will provide you with more specific zip code data and more relevant information with, I think there's been a lot of separate data sources that have been published on the Garrett County Health Department website and mygarrettcounty.com as well to make sure that people have access to a lot of the different data sources. Even though some of it's going to be a few years old, it's what we have to use, which has been frustrating for several years, especially when you're looking at maternal and child health indicators and outcomes. Right.
I will tell you, for Judy Center, we love zip code specific data.
Okay.
Because each of our grants, when we apply for continuing or new, it requires an extensive extent of need based on that catchment area. So Shelley and John's report, I was able to pull a lot of specific. I mean, they're also used to a lot of reports being countywide, so it's not an uncommon thing to say, but I do get excited when I find zip code data. Just thought I'd share.
Yeah, and I should mention, thanks Terry for mentioning that. I know that the zip code data was made available because I think Jennifer Hare is with us, our health, yeah. So Jennifer was able to find some money just sitting around in a category and said, you know what, we have some extra money. Let's get this higher level of reporting system to come in here and we're going to use it for the community health assessment. It'll give us zip code data. Hopefully it'll be continue to be used and budgeted for over the next few years to make sure that the health department can partner in a greater way with community partners and state level partner to say, here's what Garrett County is doing with zip code level data. And this is how much more accurate data can be if you go down to the zip code rather than a larger geographic area where, for example, McHenry, even though it has some very expensive homes, the property values are over the top, overrated, but there are some not so wealthy people that might live in the McHenry area zip codes, which has eliminated funding before programming. Initially it did for I think the Healthy Families program, until we had to do a request to let the, what is that? There's some community action, Garrett Land properties behind Shop and Save that were excluded from some Healthy Families programming before because they were in that encashment area of McHenry, which was a over-the-top zip code for property values and income. So that's how the zip code level data can help if you keep track of it and utilize it to your advantage. All right, we can go on. So there does have to be, and everyone probably on the call today is familiar with this, there has to be an incorporation of evidence-based programs and models. It can also be a promising practice. The LMB will be required to identify strategies which are such as target population, name of the evidence-based intervention, research citation, or clearinghouse used, and the clearinghouse rating if applicable. The LMB will also be asked to share any specific wins and challenges for each of the strategies funded. Is there anything else, Lindsay or Katie, about this that needs to be talked about?
I think we're good.
Okay, good here.
No one has any questions or anything?
Next slide. How many slides do we have? 12?
A few.
No, we don't. No, that's the full slide. There's 80
There's
some slides.
70.
No, the one we're using for today's meeting.
Oh,
It's not 70. Okay.
Maybe in the 30s, including the data.
Oh, we're gonna do that. Oh,
Just
that's
the
right.
one
We
section,
have the
just the
example.
one.
Yeah.
Yeah, we're doing
We
an
got it.
example.
We're good.
To show people how this will work through the whole planning process. So the next section, universal evaluations, outcome indicators, and progress measures. The LMB will adopt required measures. We have to. These are going to be our outcome indicators, progress measures, and/or system measures, depending on how we identify those within the 4 enough result areas to evaluate the outcomes of funded initiatives. These are provided by the Governor's Office for Children. Now we're going to go through an example just to show everyone what this will look like and how it will be applied to Garrett County, for example. The next bullet talks about how much, how well, and better off performance measures. This is where the RBA, results-based accountability people, will say, oh my gosh, I know what this means. I can describe it without any issues at all. Katie, would you like to do that since you're one of our newest people? No, I'm not joking. I did tell Katie I was going to put her on the spot. during the meeting.
all the time.
Yeah. And so the interesting thing about, just to let people know, the how much, how well, and better off. The better off performance measure is the one that programs have the littlest control over, but it's the most important one. And people really don't like to answer the question, is anyone better off, based upon what they received from your program or what service you provided them, because a lot of programs don't know how to assess that. And so it's challenging if I say, Henrietta, are you any better off now than when you started going to the swimming classes at the park? And
Hopefully I could say I could swim.
yeah, she said, you'll say though, I wear my arm floaties constantly because I don't want to fall in the water and forget what I've learned at the park. So the last bullet on this page, or this slide, says the LMB and its planning partners are expected to examine local data, which we do have a lot of, including disaggregated data, which has been very helpful, and when available. Lindsay, can you let people know how we disaggregate the data?
So the data that we have came from the data dashboard, the Enough data dashboard provided by the Governor's Office for Children. Not all of the data was available disaggregated, but what was available to be disaggregated, I believe, was by race most often, maybe some by age, a couple points, but the majority was by race. And we have some comparison between Garrett County and then some comparison counties.
What are is that on the example that we're going to
Yes,
use? Okay,
yes.
so we'll wait to get to that. All right, any questions on that information? Okay. So here are community support initiatives. Some of you may know or heard about this if you've been involved with the LMB planning process before. These community support initiatives, I can let Lindsay maybe talk a little bit about that. about what that actually means. It doesn't have to be a program, right?
No, it doesn't have to be a program. No, these bullets kind of help describe what the community support initiative is, but I feel that it kind of has, that's almost like what has replaced the program in previous community partnership agreements, where it was kind of
Yeah.
like a program or a community support. Now this is a community support initiative, which is a bit different.
Yeah, so in the past, our community support initiatives has included the housing feasibility study
Yes.
and the apprenticeship initiative for the underemployed or unemployed transition, 16 to 24-year-olds. It was
I
the
believe that's
apprenticeship
what it
program.
was. Yes.
So that was in the past few years, that's what a community support initiative was. For fiscal year 26, and Lindsay specified that just a few minutes ago, that will be what how the programs and strategies implemented for funding will be addressed as. And again, we thought it would be important to include, mention the capacity building grant on this slide as well. And we did specify the towns or either the jurisdictions in the county that are under the capacity building grant. Right, anything else? We'll move on.
Oh,
Oh,
sorry. I'm
something
not
happened.
sure what happened there.
We left the meeting.
Oh, Lindsay.
I'm sorry. Brief intermission here.
Did you want to mention the community sessions that we're going to be having in April? For
We will do, let's do that right before we get to the example.
Okay. Sorry, everything just went away.
To talk about.
Oh, we're waiting.
My apologies, guys. Just everything was gone. I don't know,
You must have been like
over the X instead of the, I don't know how I was up there.
Well, they can, at least people can still hear us. So I think it's, the meeting is still running.
Thank you, Katie.
Although and it's still being recorded, which is good.
Okay, it's very good.
Okay, great. Oh, it's back. All right, great, wonderful. Okay, is that where we?
Get ready to go.
Yep. Okay. So I'm gonna be able to read that.
If you can't read it, I'll give you a.
I can read it. So this is benefits access. This is actually something that used to happen with local management boards when we had I think it was called the Navigator, Family Navigator services that were funded through the local management board. That probably stopped back in 2012 or 13. That's when when the local management board moved over to the health department under our office. But there used to be kind of a family navigator position that was funded within the local management board, not a community partner. So benefits access now in the fiscal year 26 proposal, it's again related to some of the enough result areas. The intention of this is to strengthen benefits access for families and children. And so people might say, well, my gosh, we already have that. Because I think, Corey, does Mountain Laurel have a navigator?
He might be asleep.
No,
He's muted. maybe.
he's muted. I know there's Community Action, I think has a navigator, right? Still,
Well, I think they're just service coordination.
all service
Their
coordination.
entire
Okay.
department.
But there's an insurance person there that can talk
No.
about, no, there's not.
I don't think there's no insurance. Yeah, the Mount Laurel.
Mount
does.
Laurel, I thought they did.
No.
Okay.
Yeah.
And I don't know, Shelley and John, do you know how many there are in the county that can do the insurance stuff?
Hey, can you hear us?
Yeah, we can hear you.
Yeah. So for most of the insurance stuff, that depending on what they qualify for, we have our perk. But obviously, Mount Laurel is a major piece, and then AHEC West does a bunch of that coordination. But the MAP office at Community Action is also a major piece of that referral network.
Okay.
Oh, right.
Yeah. All right, thanks. So so this component under benefits access, if the local management board wants to prioritize this, and here's the concept behind this. We've heard in meetings, it's been addressed, and I think this was addressed in the local Health Improvement Coalition. I think it's coalition or committee, the LHIC meeting, Health Planning Council. There's always been a discussion, and the public school system will say the same thing. Everybody is supposed to, in theory, the free and reduced meal application. Very few of those actually get turned in. So does anyone really know how many families in Garrett County communities are food insecure, would meet criteria for SNAP benefits, for WIC programming, all of the things that you can see up here on the slide. So we're not sure that anyone really truly knows to the extent that it exists. I know that there's been a lot of work done recently with food access, food insecurity, the food needs in the communities. It's been talked about in the community health assessment. It's been talked about in a variety of meetings with the Behavioral Health Education Task Force that our office helps facilitate, the Garrett Roundtable, which hasn't been up and running for a couple months now, but it's been talked about in that meeting as well. And it's been talked about in our local manager board meeting, of course, as well as a variety of other small committee meetings and just casual conversation in the community over the past several years. So benefits access might become a more significant component that the local manager board might take a look at within the next couple months. And it doesn't mean the local manager board itself will do it, but what it might mean is we might partner with somebody to provide some additional funding potentially to help expand the navigation or the benefits access issues that are needed in the community. Next slide. Analyzing local data. We mentioned this a couple times already today, the data dashboard, the Enough Data Dashboard, which isn't the most helpful or up to date, but it's something that we're required to utilize for the community partnership agreement. The other set of data we're going to use is the 20 to 27 Garrett County Community Health Needs Assessment. And we put the link in here. It's in the slide. It's been uploaded. The link's also active, I think, in the My Garrett County upload document as well. And did we decide we're going to include what are we including on that from the health assessment?
The top 10 prioritized.
Yes, that's in here, right?
Yes, I think it's the next
Is
slide.
it the next slide? Okay.
Yes, very next one.
Yes, so great. Yeah. So this is what the top 10 priority areas were identified as in Garrett County with the community health assessment for 25 through 27. And it's interesting, we talked about this with Henrietta yesterday. Henrietta wanted to know, what does access to healthcare mean? So we looked it up real quick and we read it and we said, it's more than just, because you remember what you wrote? You have notes there.
I have notes. Is it lack of transportation to get to the healthcare, or is it lack of doctors and facilities for healthcare? And since I also sit on the hospital board, I can tell you that we have a very, very good hospital based on the awards that it's won and so on. My question was whether you just can't get there. Or, as we pointed out in the discussion yesterday, sometimes it's the length of time between when you called saying you need to see a doctor and when they're actually going to be available. It might be months before you can get to see someone when you need them now. Now, we do have urgent care facilities. And then there's another question tied with that would be whether your insurance permits you to use urgent care situation.
Yeah. And so what we did yesterday when Henrietta asked these questions is we opened up the community health assessment and we went through some of the focus group stuff and kind of, I think was it focus group that we shared with Henrietta, or
I went
it was
into the
summary,
narrative.
the
Yeah, it was the
narrative,
summary.
that focused on access to healthcare and how that was actually defined in the community health assessment. And so then you can see jobs, wages, economic development, affordable housing, mental health, health insurance, chronic disease, and that includes a variety of diseases, of course, education, physical activity, dental health, child and adolescent health. So when you look at the top 10 priority areas, and then you go back to the slide that had the 4 result areas for the Enough initiative, and you think, okay, well, a lot of those, if not all of them, somehow blend in with those Enough initiatives. And so the question becomes, what can the local management board do with the community partnership agreement to not totally be responsible for, but utilize with partnerships the funding that it receives from the Governor's Office for Children to help support some of the existing initiatives? Or is there something new that hasn't ever been tried yet, but would address some of these priority areas for the health assessment, as well as maybe 1 or 2 of the Enough priority areas in the Governor Moore's Enough initiative? So those are things to keep in mind when you're taking a look at the survey. When people are listening to this recording, they may not, because it might be too long to listen to, although we've only been talking for like 41 minutes, I think, except for the break. No, we talked even during the brief intermission.
We did.
Okay, any questions on the top 10 priority areas? And can you see the link, or do you remember some of the stuff that we've talked about already to kind of say, yeah, I can see how the Enough priority areas kind of match in or sync in with these priority areas that Garrett County people identified? That's rhetorical. You don't have to answer. Okay,
I
let's
will
go.
answer one thing, however. Under mental health, primarily the mental health care had been done through the health department, who has that side of it.
Mhm.
The hospital now has, I think they're calling it the Wellness Center, across from York Glade Elementary in Dr. Miller's old office. They're going to have counselors in there. And also, I remember Mark Bucco talking about a pediatric psychiatrist that is coming aboard for that facility. And I would think that that would be much needed. What we need to do is publicize that that facility is going to be available to supplement what is done here at the health department. It gives us another facility that can do some work in mental health, especially with children, but also with teens and adults.
Yes, and likewise, and I think it's even more than supplement. I think it provides choice for
It
people.
does. It
And
does
so
indeed.
just like Mountain Laurel provides choice,
Yes.
so would health and wellness. People could choose to go to the Center for Behavioral Health up at the health department. They could also go to Mountain Laurel. There might be some more stipulations about services in each one of those components. And of course, insurance and or Medicaid could be an issue, as well as access. And that's what access to healthcare, and what you, in the focus groups, what happened with access to healthcare, it wasn't just going to your primary care physician,
Right.
or a quote unquote specialist. It was mental health and substance use disorder treatment services. We call, there's a wait list.
Mhm.
It's going to be 3, 4, 5, or 6 weeks just to be able to go in and talk to somebody.
Right.
I do not want to have to wait that long for myself or my child. So then what do you, as a system, what do you do? Because we don't have any behavioral health, quote unquote, urgent care facilities or programs. What we do have is a mobile response stabilization services program. However, that's not yet been up to a 24/7 capability. They can do phone support, but it's challenging to do 24/7 in-person support. The emergency room gets overwhelmed sometimes if people go there. We don't want people to have to go to Garrett Regional Medical Center to go to the emergency room if they're having a mental health crisis. We want to have community response go to their home rather than them going to the emergency room. If they need to, that's fine. It's not that they shouldn't or can't, but we want to help people, divert people from the emergency room. and have them get some urgent care services if needed. So thanks, Henrietta, for asking about the mental health. But you know, there's a workforce issue as well. And so how does that address the opportunity, the employment opportunities and the career options or choices for our local students who want to pursue maybe some health related careers?
Right.
Okay, let's move on. So we mentioned this earlier. These are understanding the enough data, the result areas. Lindsay or Katie, can you summarize those real quick?
So the four result areas are the cradle to career education, healthy families, economically secure families, and then the safe and thriving communities. And then there are three sort of measures to measure those result areas. The first one is an outcome indicator, which focuses on population level data, which helps quantify the amount of impact a strategy has within the result area. And then there's a progress measure that tells us how well a program, agency, or service system is working and if the project is on track to succeed as planned. And then a systems measure, which assesses the performance and functionality of a system as a whole to equitably deliver information, benefits, and or services to a population.
Great. Thanks, Lindsay, for sharing that. And so when we go to the next one, is this where our example starts?
I believe that the data starts.
Oh, the data. Yeah, but we're using the data. We can go into the next one.
Okay.
Okay, so here's the example we're using to show you how those indicators will look on paper and look in the plan. So we selected economically secure families as one of the enough priority areas, correct, Lindsay?
Yes.
So this is what you all remember from your previous learning. We're going to do your kind of semi-long-term memory for this example. So here's some local data and some components that are believed to be important that will contribute to help justify economically supported or the needs for economically secure families in Garrett County. So these are the outcome indicators. Primary age employment, 25 to 54, median household income, percentage of families spending greater than 30% income on housing for rent, and or percentage of families spending greater than 30% income on housing for mortgage. Food insecurity rate, percentage of full-time workers aged 19 to 64 with private insurance. Is there any more for this one?
This is it for the outcome indicators. And I do just want to also point out that these are kind of set by the governor's
Yes.
office for children. These weren't things that we chose, and we can supplement the data that the governor's office for children provided to us with some of the local data, like the community health assessment. But we do have to use these data points, and also to bring up a results-based accountability aspect of things. We can always develop a data development agenda if there are some points that we think, hey, this does tell us a lot about the result area, but we just don't have great data for it. We can kind of keep that in mind and figure out how do we get that data.
Okay, great. Thank you for sharing that. Okay, we'll move on to the next one. So here's the prime age employment rate, ages 25 to 54. And this is where Lindsay referenced earlier that we have Garrett County data, and then we have comparable data with counties that are close to us, and then counties that we usually use Kent, Caroline, which are more comparable with population and income, I believe.
Yes.
And that's the reason we use those. And so here you can see the data, what's been showing. And again, we referenced earlier, the part of the quandary here for this data is that it's a couple years old, which that's really what we have to work with. There could be some additional data that we could maybe supplement from either the community health assessment or other data resources when it comes to employment rates for the population of Garrett County. But then we would also have to have corresponding supplemental data from all the other counties, which makes it a little more difficult and not as meaningful then to say, well, because we can't compare Garrett unless there's the same data points are utilized in the other counties. And right now, we're not positive that they are. All right, we'll continue then. So median household income, this is what is showing for Garrett County.
I don't believe that.
So Henrietta says she doesn't believe it. Do you think it's too low or too
I
high?
think it's too high.
Too high.
So this is household income. So if there are two income households, that would,
Yeah.
that would kind of skew it a little bit higher.
You would need a two household income to get that.
Right. In a lot of
Some
cases, yeah.
households like mine, when my kids were at home, they would have taken my kids' income into account as well. So that would have pushed our household income way higher.
And that median household income of two people were working minimum wage, that would be about what? That would be.
Yeah, it definitely would take two incomes to get, at least two incomes to get to that, knowing the jobs available in the county.
All right, let's go on. So remember, these are required data points that we have to incorporate into the community partnership agreement. So here are the percent of families spending greater than 30% on rent of income and greater than 30% of their income on mortgage payments.
Mhm.
The mortgage is in the orangish, reddish orange, and the rent is in, I don't know what that is, aqua, teal, or something like that. So any thoughts about the data that you're seeing related to our Garrett County, and this is Garrett County,
That's-
correct?
Garrett County.
Yes,
only,
Garrett County only.
from different years.
Mhm.
And even then, the most recent there is 2022.
Right.
And we're looking to go into 2026 with this agreement.
Right.
So it's kind of old data, but
It is.
I think it's interesting that rent is going up, but mortgage is going down.
I think that's less people are buying it, kind of thing.
Or people bought around COVID and their household rents, the mortgage payments are less.
That's true.
Well, there's some truth to all that. And so then part of the thing is when you have discussions like in meetings such as this, a lot of it will be kind of anecdotal. And so the question is, well, if you can't, landlords are kind of maybe elevating their rent payments because they know people need places to live. So is it a business choice that's being made? Landlords are charging $1,200 a month plus utilities or $1,500 a month plus utilities. I'm not sure if that's true, but some people have said you wouldn't believe how much our mortgage would be less than the rent payment.
yes.
And a lot of people say that, but then when you have the conversation about, well, what's available to buy? When you look at the properties that are available to buy that are quote unquote, and I say that affordable or reasonable, they might not be livable to the extent that people want to live in those
Right.
available properties, depending on where the location is, and then that brings up Henrietta's point earlier about access to healthcare or just resources in general. Are you going to reside in a food desert in Garrett County?
Right.
Are you going to reside where you might have limited transportation? And how does the county address transportation issues for people who lack modern or reliable transportation?
Yeah. Can you also argue that people with mortgages could more likely work out of the county and be earning more because they've got the transportation to get, like, you could be working in Allegheny County and earning more, so that pushes the percentage of your income of what you're spending to be earning more. You know what I mean?
Yeah, they could.
Yeah.
There are several,
Yeah.
I think, people that live in, or there are people that do the opposite too. They
Yeah.
live out of the state because of West Virginia or Pennsylvania because the cost of living in Maryland seems to be a little bit higher, but they'll work in Maryland.
Mhm.
So we've heard that in focus group conversations and meeting conversations that have taken place. And the question is, how does the LMB play a role in that with the partners that we already have or could have over the next year or so?
Mhm.
All right, let's move on then.
And we did point out yesterday too, that it looks like you'd be better off to buy a house and have a mortgage. But do you have the down payment that you need to get a reduced price mortgage?
Well, the other issue there was, is it livable?
Right. And is it going to be livable, what you can really afford?
Okay, here's our food insecurity rate data from 2018 to 2022. Garrett is the lightest color on there, I think.
Yes.
Light blue.
Yeah. Any thoughts on what people are seeing here with the trend line data? Remember, it's a couple years old.
Mhm. Yeah.
Some people might suggest that it might even be at a higher rate for food insecurity in 24. Well, even though we're in 25. I
It
lost the
looks
year.
really bad for Allegheny County on here, that they have more people with food insecurity than we do. They have a greater population, but not by much, I think. But they used to also have a lot of industry that they no longer have. The paper mill was the last major one to go out. And we know that impacted Garrett County as well.
It did. Yeah. And so we did briefly talked about food insecurity earlier in today's listening session. And there have been some important developments that have taken place over the past few months. It's been working on it, this process, several years, but the real development stuff has been happening, over the past several months in Garrett County. And there'll be an event, I think on March 28th,
Yeah.
4 to 6 p.m. on Liberty Street. I always forget the name. I think it's 360. It's like a full circle.
I think that's it.
Type
Yeah.
of thing, address, yeah.
Yeah.
So it'll be a very nice opportunity for Garrett County to actually put something into action. And the question then would be, is anyone better off? So this would be a wonderful better off outcome to assess in a couple years, to say, how has this resource or these resources contributed to, and there'll be other things that'll happen as well and be blended in with this component. How does this make people better off, and families and children and the communities in general? And does it contribute to any of these other enough result priority areas to enhance outcomes without doing any specific clinical service or other type of thing that involves high intense need services to a family or a child? And it's simply community people coming together with some grant funding or other resources and saying, hey, this is what we're going to do. And this was a need, and this is what we did to address this need. All right, let's move on. So percent of full-time workers age 19 to 64. Ooh, I almost got the year. This one was born with private insurance. So private insurance, you can see, is roughly what?
44.1.
And other insurance
Or
or
non-insured.
non-insurance. Would that be the difference from 100% to 44.1%?
Yeah,
And it
comes
share
out,
the
it's 55.9.
You all don't understand. Lindsay almost had a traumatic experience because the chart would not come out to 100%.
John, back me up here. You can't have a pie chart. It's just willy-nilly, not 100%.
Right.
But we've talked about the cost of insurance. Some people struggle with, it's not offered, or the insurance, if they get it, it's not covered by a lot of providers in Garrett County. Now, the other positive thing, I know people that have attended the Local Health Improvement Coalition meeting have heard that you can now, I think still, at least we think it's still that way. If you're still eligible for the health exchange, if you do have employer-based insurance. So not everybody in your family has to be under your employer insurance. They could get exchange insurance as well to make it more affordable, feasible, convenient for the family unit. All right, let's go on. Economically secure families. Okay, these are the progress measures. So these are, again, all required, right, Lindsay?
Yes, correct.
Okay, so there's several here. Number of active apprentices. Do we have any?
No
I
data.
don't,
Yeah,
there's not
no
great
data.
data.
There's no data.
We do have some.
We do have some.
Oh,
Labor-
there's 6 active.
6 active apprentices.
Labor force participation rate for women ages 20 to 64. Participation rate ages 20 to 64. Is that going to be, so that's for all?
That will be tough. Yeah.
That's okay.
Yeah.
And then there's a separate one for women.
Yes.
Okay. Number of individuals with homelessness services, all types, by Maryland Department of Housing, that's DHCD. Maryland Balance of State, that's an enough data component. Number of households exiting homelessness to permanent housing. That's a very challenging data point to find or to have updated information, but we can use the partnership that we have with Community Action because they're part of our local management board to hopefully answer that question more accurately. Number of students who were unstably housed in the last 30 days, grades 6 through 8, and also grades 9 through 12. We get that information from the Garrett County Public School System, although that doesn't start, I think, until September or October, if I'm not mistaken.
I think, and I think that the Enough dashboard may have used YRBS data for that
Okay.
point.
So we have two data. We have the real data from the school system, or what we think is real data, more accurate data. And then we have the YRBS data, which is a moment in time type of thing, I think, right? It's usually, John, do you know when that's done, or Shelley, when that's done, administered? Or anyone that's with us today?
They just do it.
Well, I don't know. I just want to know what month it's done or what time of the year. Bless you.
Thank you. I was also thinking it was recently done.
Yeah.
So
Like
that might
this
be
year?
right.
Yeah.
Yeah, I
think
like
it's
within the
up to-
last
yeah.
couple
I
of
can't do
All
it.
right.
What was the question? There's a lot of traffic.
John, roll the windows up. Turn the radio down.
Oh my God.
The question was, does anyone know when the YRBS is administered during the school year?
The light.
Sorry, hold on. I don't know exactly when during the school year it's administered. I know the last report just came out because there was a delay this year. We did not get the full Excel tables. Instead, we did not get the full PDFs. Instead, this year they released Excel tables. So we just got, I believe, the 2023 results. I don't have it in front of me, but there's generally a pretty good, almost a year delay, and then this year was even further delayed because of some different contract issues. But it is available.
Then they retracted for a bit.
Yeah.
Yes.
A quarter mile.
So
Right.
TBD on the YRBS. That's also under the CDC frame
Okay.
of things that might change as well.
Okay, yeah, because I'm not sure if you heard, Lindsay and Katie and Jillian were saying that they thought it was recently administered in the schools.
Oh,
So
I
what,
just looked it up and it says it's conducted in the fall.
a fall?
I was going to say October.
Fall is,
I think around October.
Okay, so that
Maybe
means
beginning of
if it was this year, it would have already happened.
Yeah.
Okay, all right, great, thanks. Thanks, John, for,
Yeah, and it's usually like spring when we get the results.
okay, that's cool, great. And then the last one on here is, that's a progress measure that's required to be included. Number of individuals receiving temporary cash assistance who become employed. And so there was no data available on any of that.
Yep.
Which some people have already expressed some frustration about.
Yes.
Jillian did. So the enough data dashboard indicates that in 2024, there were, well, we already have this. Okay. never mind. We already did that. You already answered that question.
Yeah, we talked about it a little bit.
So this is the data related to those, what we just talked about. So
Yes.
when you all look at this, Is there anything that you think could be, that's worthwhile of being focused on or should become a priority for the local management board? It doesn't have to be yes today, yes, definitely, but just keep that in your mind. If you could do the survey that Lindsay developed to maybe help us a little bit better so we can have some participant survey results to say, here's what the community has reported as being an important component for them related to these different measures that are required. Okay, let's go on to the next one then. This is the whole population, correct, of ages 20 to 64. Okay, but this is from 2022. Again, you have to understand that we're going to have a 2 to 3 year delay in the data being collected. And we'll move on. So if I don't hear anyone say anything or yell, we're just going to keep going. So here's the percent of students who were unstably housed in the last 30 days, grades 6 through 8. This is Garrett compared to comparable counties. And when you look at that, it's doesn't appear to be a very good thing, outcome.
What kind of number would we be looking at then?
What
Kind of number, 3%, was it 3% of 3,000?
Well, 3% of the 6th through 8th graders. So I'm not sure how many
Okay.
middle school age students we have.
What
We
we,
could find that.
yeah, what we might want to, what we'll probably do is we'll do it like a little explanation under here to say this Garrett County has this many, like 6th to 8th grade students enrolled. But this again is from 2022. So it usually this stays pretty consistent when we've, during our roundtable on homelessness meetings and when we've spoken with the public school system, they're a lot of times really surprised about the number of kids indicating that they don't have a regular fixed nighttime residence. All right, we'll move on to the
High
next
school
one.
numbers.
This is high school
higher.
numbers, yes.
Almost twice what the middle school is.
And we do believe, is this from the YRBS? Do we know? I
Believe
think
that
it
it
is.
is.
Okay. So it'll be interesting to see how, like when we're doing this next year, if this number, how it compares to this 22 data. All right, we'll move on. And so keep in mind if you go back to the slide, when you're looking at school-based data, like 6th to 8th grade, 9th to 12th, even though it's focused on students or kids, there are other people like the family members, right? It's mom, dad, grandma, grandpa, aunt or uncle, or it could be other friends, family members, family friends who the kids are residing with or not residing with. So when you have one student that says that 3% of those kids, or what was it for the high schools,
5.9.
5.9, 6% if you round it up. That 6% of the total student population for the 9 to 12 graders could be doubled or tripled depending on the family size of their household. And so then what's available, not just for that child, but what's available for the family members? And how do we ensure adequate housing or stable housing for those? If it's 25 kids, now we're up to maybe 50 or 75. That's without having siblings in the house. Economically secure families, system measure. Number of individuals enrolled in Supplemental Nutrition Assistance Program or SNAP. Number of households that received a child tax credit. Number of households that received an earned income tax credit. Here's the data that shows this.
Where do we get the data for the child tax credit?
Katie, can you look what's cited on the dashboard?
Oh,
Sorry. We'll find it for you.
Okay.
Can Can I navigate away from this?
I think so.
Yeah, both that and the earned income tax credit. I just wonder where we
Yeah.
get that data, whether we get it from the Internal Revenue Service
Right.
or
So all of the data that I pulled, like I said, came from the data dashboard provided by GOC, and they cited Comptroller of Maryland for the child tax credit and for the earned
Okay.
income tax credit.
so that's based on their state tax return. Most likely.
I would say. The data dashboard is pretty cool if anybody wants to look at it. Limited data for Garrett County, but what is on there is neat. And that is also linked on each of the slides that have the indicators listed. It says scorecard, and then there's a link. That's what that goes to. So we ready for the next one?
Yeah, the next one I think is gonna be the child tax credit.
Yes.
Number of households that received child tax credit. This again is from 2022.
Is the most recent.
Well, yeah, it has a 3-year trend line. Well, it's not a line, but 3-year bar trend.
The trend lines look messy. We tried to.
Oh, yeah.
Yeah,
Okay.
Washington really throws everything.
It does.
Yeah, Washington does.
Mhm.
They must have a lot of families living there with children.
Washington's
More
a
than we
a
do.
big county. Yeah.
Bigger population.
Much bigger
Yes.
than us.
Yeah,
But if
and
you
they're
did-
looking at number here, not percentage.
Right.
Yes.
Right.
But even if you looked at the Garrett County numbers, though, it's relatively consistent, seems to be.
Yeah.
So
The numbers on the other one, the first one on nutrition assistance, the numbers have gone up from 49.52 up as high as 53.18. So that doesn't say a lot of good things about us, I don't think.
well, the good thing is it shows that more people are applying,
Right.
but we still hear, and you'll still hear that it's still, a lot of people believe it's way underreported.
Mm.
Mhm.
You'll see that the state changed the income guidelines to apply for it. They did.
I don't know.
Yeah, that would be another question you could ask Alicia.
Mhm.
Because sometimes they'll do that.
Yeah, we'd need to check with Alicia
Yeah.
on that.
If the guidelines went out.
And what they're showing there is 20 through 22. That's your COVID time when I think a lot more leeway was given.
So it is interesting that in 2029, we were at 49.52, which is higher than 2020 and just a little bit lower than the middle of COVID.
On the tax credit or on?
Oh, I was still looking
On
at
the
SNAP.
Oh, I'm sorry.
Lindsay, can you go, is it one slide back or
Is that
snap?
on?
So people,
Oh, just this one. Okay, sorry.
oh, there it is. Okay.
Higher than before COVID, actually.
Okay. Great. I think, was that the last, data example that we're using?
So there's two, well, there's the earned income tax credit, which we looked at a
Oh, we
little
did that one.
bit, or the child tax credit, I'm sorry. And then this one's the last one, the earned
The
income.
earned it.
So this is the last one.
So again, this is the last required data point that has to be used for economic, I forget the result area, or the enough
So
things. that-
economically secure
economically secure
families.
families.
Yeah, secure families.
There's a lot of words floating around.
I don't know what the acronym would be for that.
ESF.
ESF.
Yes.
Right.
Do we know how many households there actually are in County Fair?
I don't.
So that data, I believe, is available.
There's 12,448 households.
12,000.
I was already on this.
So the question would be then, to
12,448.
to make this meaningful though, is you'd have to go by year to
Right.
Yeah.
have an adequate comparison for
Right.
that. So the 12,448, what year was that, Katie?
That was,
18 to 22, maybe.
yeah, 18 to 22,
So it must be like an
So-
average.
Oh,
which actually,
Is
yeah,
close.
which, I mean, goes along with this partially.
Yeah.
20 to 22.
Yeah.
no, it was from 2018
Yeah, it was
through
18 to
2022.
So they
So yeah,
probably
like half.
averaged it.
Yeah.
So that's what I get.
Average.
You get income.
Okay, so that's a run through of what the community partnership agreement, how will we put together, depending on, and so depending on the prioritized result, enough result areas that the LMB decides to focus on. So what Lindsay has done, and I think Katie and Lindsay worked on, Jillian as well, when they were all out in their commune type of thing in the office that we have. It's their unsheltered area. So they did this with all 4 areas, correct?
Yes.
Or-
The survey reflects all
Survey.
4.
Yes,
Yes.
but the longer PowerPoint addresses all the data components,
Yeah, right.
which is like 82 slides
It's a
or
lot.
something like that. We didn't want to go through that with everyone. Just wanted to give you kind of a snippet about what the full PowerPoint looks like. And then I think in the survey, there are live links that will let you look at the specific data points if you so choose to do that.
Yeah, so this link here will take you to the full presentation, including the full data set, which was also emailed out.
Yes.
Mhm.
Do you want to scroll through the survey and just show what it looks like?
If you think that would be helpful, if everybody online wants to see that, we can do that real quick. We'll let you go to the next slide though without competing anything. Sometimes it doesn't.
There's only one
Oh, there's
one.
only one.
page.
Okay.
Yeah.
So it's important to pay attention to the directions. Right?
Right.
Okay.
Always.
So we're asking people to rank kind of what your top priority would be. And you're not required to rate them all. You don't have to do all 4. But if there's one that you say, this is the only thing based upon what I've read, what we've looked at, what we've talked about, what I've heard talked about over the past year or so, or since I've known about the local mentor, this is what the local mentor should prioritize for fiscal year 2026. And so then you move on down. And you'll be able to see cradle to career education. This is enough result. This is one of the enough result areas. Think about the data you received and related to the result area. And so here's where it asks you, who are the partners? And so this is where those of you who have had results-based accountability, exposure to that or trained in it or both, you will see we want people to kind of let us know, who do you believe the partners are that could enhance this? If this enough result area is selected, who helps with this result area? Now, look, the good thing is it's not programs, because we didn't want people to bias the result with picking a program. We just want to do partnerships first. Then we scroll on down. You can click as many as you want to, correct?
Yes.
Lindsay?
Yep.
Then you scroll on down to the next one, and you can also do other, but you have to put something in there. What works to affect the data? What strategies can be implemented to cause change related to cradle to career education? Include low cost and no cost ideas. We'd like people to put something in there, type an answer. Then you go on to the next enough result area, which is healthy families. It's the same type of process with the remaining result areas. So we're not asking people to give us a name of a program or service. We're asking people to say, who are the partners that have a role in impacting this result priority? Should it be selected? Same with economically secure. And the last one I think would be that communities are safe and thriving communities. And then you submit it. And the staff of the local management board, local behavioral health authority office will not complete it because we're not supposed to do that. We are kind of like work with and work for the local management board and the mental health advisory committee. We work in relationship with Drug Free Communities Coalition and several other existing entities in the county. So we don't want to bias anything by completing the survey. All right, any questions, any comments about what you were presented with today? All right, well, thank you all. We enjoyed this hour and 19 minute togetherness opportunity. You can complete the survey, please. Take the opportunity to do that. There's a QR code. I think that's what it's called.
Yes.
That is functional, right?
Yes, thank
Now-
you, John Corbin.
What type of, is this what are the two different types?
Dynamic, or static.
Is this a static or
it.
dynamic QR code?
I sure
No
hope
idea.
it's dynamic. And this, John's wonderful. This link will never lose anything.
Yeah.
That form should live forever.
Okay,
I hope.
so that might mean it's dynamic.
That might be what that means.
Okay.
I don't really know
We're
anything.
using a lot of words.
We are.
I'm just winging it. Yeah.
We have an IT thesaurus
Yes.
that we're using.
That's Google. That's right. Google.
All right, thank you all. It was great to have an opportunity to speak with you today, and we enjoyed some of the feedback we heard. See ya.
Bye.